Observant, clinical. Biological data follows a predictable trend until an external shock forces a deviation. Here, a stable baseline violently fractures, spiking upward by 3%. These spikes appear in the clinical records of Sheba Medical Center's weight management clinic, where patients receive targeted, hospital-based care, specifically designed to stabilize or reduce their body mass. On October 7, 2023, that clinical environment was superseded by Operation Iron Swords, subjecting civilians to the immediate trauma of regional conflict. Researchers analyzed this rupture by collecting survey responses from clinic patients, a median of just 58 days after the conflict erupted. Within this 2-month window, 25.4% of the surveyed patients experienced acute, clinically significant weight gain.
The data suggests that acute regional trauma can rapidly override standard obesity care, necessitating a strict reevaluation of clinical triage protocols in conflict zones. A 3% increase in body mass represents a critical clinical threshold, as it is large enough to exceed standard measurement errors or temporary body fluid fluctuations. Crossing this threshold triggers a rapid worsening of metabolic parameters, specifically impacting blood glucose and lipid levels. This acute deterioration creates an immediate requirement for increased disease-specific medications to manage secondary conditions. Curiously, the data reveals a significant divergence. While 1/4 of the patients spiked, roughly 75% avoided this gain despite facing the exact same environmental stressors. This divergence suggests that metabolic resilience under stress depends on a set of identifiable and modifiable variables. To isolate the causes of this weight spike, researchers used a multivariate analysis, a statistical method used to determine the unique contribution of several independent variables to a single outcome. The strongest predictor identified was anxiety-driven eating, which carries an odds ratio of 4.48. An odds ratio measures the strength of association between an exposure and an outcome. Here, it shows a nearly 5-fold increase in the likelihood of weight gain. The secondary driver was reduced physical activity, which showed a significant correlation with weight gain at an odds ratio of 2.50. The conflict environment forced this change. Over half the cohort reported exercising less because facilities closed and outdoor activity became physically dangerous. Simultaneously, roughly 40% of the patients reported a shift in dietary habits, increasing their intake of sweets and snacking more frequently on ultra-processed foods. This environment creates a behavioral trap, pairing a forced sedentary state with high-anxiety, hypercaloric consumption. Anxiety-driven eating is a biological response to environmental trauma rather than a lapse in personal discipline. Environmental trauma triggers the brain to release a severe spike in cortisol, the body's primary stress hormone. This cortisol surge activates the sympathoadrenal axis, a physiological system that regulates the body's rapid response to stressors by releasing catecholamines like adrenaline. Patients intuitively seek highly palatable, ultra-processed foods because high sugar and fat content directly activate the brain's reward system. This activation creates a chemical feedback loop. The reward signal blunts the stress response by actively dampening the sympathoadrenal axis, providing a temporary reprieve from anxiety. This specific patient demographic also manages a reduced basal metabolic rate, or BMR. The BMR is the specific amount of energy the body expends at rest to maintain vital functions like breathing and circulation. When this lower metabolic floor meets reduced physical activity and trauma-induced hypercaloric intake, rapid adipose accumulation becomes mathematically inevitable. The resulting 3% weight spike is a biological self-medication strategy used by the body to dampen the impact of trauma. The data from patients who avoided the weight gain reveals a primary protective factor. Consistent use of anti-obesity medications, specifically GLP-1 receptor agonists, provided an odds ratio of 0.39 against weight gain. GLP-1 receptor agonists are medications that mimic the glucagon-like peptide-1 hormone to regulate appetite and blood sugar. Standard clinical use of these medications focuses on slowing gastric emptying and inducing early satiety. Their efficacy during wartime, however, stems from their ability to cross into the brain and directly modify the central stress response. This neurochemical interference physically blocks the reward-driven eating loop, preventing the body from using food as a stress-dampening tool.
These medications function as neurobiological shields, physically decoupling environmental trauma from the body's metabolic response. Transitioning to a wartime clinical protocol requires prioritizing 3 specific pillars of care. Pillar 1 is nutritional psychiatry, which shifts the clinical focus from pure caloric restriction to active cortisol modulation. Patients are prescribed complex carbohydrates, tryptophan, and vitamin C and B to chemically stabilize the stress response. These nutrients target the gut microbiome-brain axis, a bidirectional communication channel between the gastrointestinal system and the central nervous system that regulates mood and stress. Clinicians in conflict zones must treat highly processed foods as agents of systemic stress, while prescribing whole foods as essential neurostabilizers. Pillar 2 is non-negotiable movement. The clinical purpose of exercise must be reframed during periods of high environmental stress. Prescribing exercise during a regional conflict serves to restore critical executive control over emotional eating behaviors and significantly dampen systemic anxiety. Clinicians must assist patients in developing safe indoor routines to maintain this neurological benefit when external facilities are inaccessible. Pillar 3 is pharmacological adherence. Maintaining obesity medication prescriptions is essential during acute regional stress. Clinicians must counsel patients that these medications are their primary neurological defense against trauma-induced emotional eating. This protocol directly addresses the vulnerabilities identified in the 25.4% of patients who experienced acute weight gain. Treating wartime obesity as a predictable sympatho-adrenal shock allows clinical teams to intercept these metabolic spikes before the biological feedback loop takes hold.